Terry, you want me to do a mic check or are we live?
We're live, sir.
Pressing. All right, folks, well, welcome this afternoon. I'm Colonel Steve Snelson. I'm the 6th Air Refueling Wing Commander. I'm joined today by a panel of experts from our support agencies to our medical group, and we're here to answer whatever questions you might have. Main overall objective of today is to make sure that we're telling you the latest and greatest of what's happening here on MacDill. We've all got to do our part to ensure that we're helping block the spread of COVID-19. You've probably all heard from our nation's leaders that we're considering this a worldwide crisis, and we are facing a deadly adversary. Our country unequivocally is different today than it was a month ago, but this is nothing we can't handle. It's nothing we can't handle as a base, as a military, and as a nation. I just hope you know the decisions that we are making, they're being made with the health and safety of our military members, families, and base personnel in mind. The situation, though, it's very dynamic, and it seems to be changing by the hour. We're going to do our best to be fully transparent, but we do ask that you treat us with a little bit of patience and know that we're trying to get out the facts as quickly as we can. So if you have a question, let us know. You can send it through Facebook. You can log on to our MacDill COVID website, which I think that rocker is at the bottom of our page here that you're dialed into. For the experts that are here today, we're going to be speaking on behalf of MacDill Air Force Base. I can't speak on behalf of the entire Department of Defense or the Air Force or even our mission partners, but I'm going to tell you what we are doing in the 6th Air Refueling Wing. If you do have further questions or have other information that you want to know that you can't get from our website, also go to the CDC website. It's cdc.gov. You can get a lot of great information there. And just know, I understand we're going to run out of time today before we run out of questions. So if we don't get an answer to your question, my promise to you is if you type it in there, we'll make sure we post it later. I do want to start out with a couple key updates for you. I've seen a lot of the common questions out there, and I just want to make sure we're dispelling some rumors and getting some key information. First and foremost, here on MacDill Air Force Base, between our wing and all of our mission partners, we have had 0 confirmed cases as of this morning for COVID-19. We still remain in health protection condition alpha. For the wing, we've authorized supervisors to release non-mission essential personnel. And again, that's only for the wing. There might be different reporting procedures for our different mission partners. If you have a question, please refer to your chain of command, whichever chain of command you belong to. By having us as mission essential, it enables us to reach out and recall personnel as operational needs require. So for example, the medical group, they are operationally required right now. So those workers are there. When we think about our support functions for our mission partners on here, if our mission partners have an operational need, we will respond. So while we ask our airmen to practice all the CDC guidance, including safe social distancing, as well as utilizing teleworking to the max extent possible, you got to remain reachable. This is not a snow day. This is not a time to take a vacation. You got to be ready to respond if and when we call. You can count on the fact that our enemies aren't going to wait for us to get better, so make sure you're staying connected. We also put out a local leave policy for the 6th Air Refueling Wing. For those of you that are currently on leave, you've got to get back here by midnight on Friday, and if you can't, make sure you let your chain of command know and get permission. As well as if you are taking leave, you're authorized local leave, and that's within 2 hours of driving distance via posted speed limits here. But again, check with your chain of command. There are a lot of questions out there about the stop movement of permanent change of station moves for the next 60 days, not just for overseas, but here within the continental United States. We'll have Major Dupuy, our Logistics Readiness Squadron Commander. He'll get up and talk to that here in a little bit. Let's see. For the Commissary, we have put limits in place for certain supplies, but we still are seeing a lot of panic buying out there. And what I want to ask folks is please buy what you need. Don't just panic buy everything out there. We haven't put any further restrictions on there, but we are daily communicating with DECA and making sure that we're tied with them to make sure that all of our service members and families are being safe and that we're being responsible out there. We are closing a number of our morale, welfare, and recreation facilities. Lieutenant Colonel Light, I'll invite her up to the microphone here momentarily to address those. But so far, the Child Development Center, it is remaining open. But I know we had some questions out there about the CDC, so Lieutenant Colonel Light's going to open with those. And then I think the last thing I'll do before I open it up to our experts is ID card screening. We've changed our procedures there, making sure as you come up to the gate that you're holding up your ID so our defenders can scan the code and then verify your credentials that way. That way we're not handing IDs back and forth and potentially spreading germs there. So I appreciate your cooperation there, and that'll help us keep the traffic flowing nice and smooth. But with that, I'm going to open up first Lieutenant Colonel Kim Light, our Force Support Squadron Commander, if she could come to the microphone and talk to us about a couple of key updates. Over to you, ma'am.
Great. All right. Good afternoon, everybody. I'm Lieutenant Colonel Light. The first thing I'll address is our Child Development Centers and our school age program. So first, I definitely want to apologize for the confusion that happened over the weekend. I assure you that as soon as we received word that the governor was going to be closing all of the Florida schools for 2 weeks, our team immediately responded, and we were assessing our capability to be able to continue to provide care. Many of our caregivers, of course, are parents too, and so that impacted them greatly. Throughout the weekend, we assessed our capability and realized that we would not be able to open to our full enrollment on Monday. As such, the decision was made to make those phone calls to our parents on Sunday. The initial ask was that if you had the ability to keep your children home due to maybe a spouse who teleworks or a spouse who is in student status that would be home and able to care for those children, that you do so. Additionally, we were asking our single and dual military families to contact their chain of command to find out if they were in fact mission essential and needed to report to work, or if instead they could keep their kids home. As a result, on Monday, we were able to successfully care for all the families that needed it, and again today. So thank you for everyone for your part in allowing us to do that and also allowing our caregivers to care for their families. So going forward, we will continue to operate with those premises. I know there was some confusion on if a mission essential letter was actually required. We are not requiring that. If you are essential to your operation and you need care for your children, you absolutely can drop them off at the Child Development Center or the school age program over the next 2 weeks. This will remain a very fluid situation, and we just ask for your patience and just please understand that we definitely care about your families, and we will do everything we can to take care of you. Additionally, as far as the fees, there was a lot of questions about the fees that families are paying right now. What we're going to do is, if you're a normal enrolled child and you are not, your child is not in the program this week or next week, we will credit your account. So you will have those credited for a future balance when we open back up to our normal operation. And then going forward, if this does extend longer, we will not process payments. So if your child is not in care, you will be either credited, and then in the future you will not be charged further until we're back open. So I think I'll stop there, or do you want to go to questions, Terry?
No, we'll kick it back.
Okay.
Kim, while you're up there, can you talk about what other MWR facilities are closed, or instead of going through the whole list, how we find out that information?
Absolutely. So a lot of our what we call MWR functions are non-essential functions. We made the decision to close those effective today. So that includes things like our golf course, a lot of our dining operations, and the other fun activities on base, the bowling alley, the arts and crafts center. And again, that decision was made in order for those families to be able to be home and self-isolate as needed, and then also to prevent any large gatherings of people. We do have our dining facility open. That is the one feeding establishment that will remain open on its normal schedule. So any of our dorm airmen that are on ESM, they can certainly go there to get their food. And in addition to anybody else who is now mission essential or working on the installation, anybody is allowed to go in there and pay for their meal. Some of the other closures include, Oh yes, some our outdoor rec programs like the marina, the skeet range, and then what we're going to do with Fam Camp is there were some questions about that too. So what we're going to do for our Fam Campers is we're going to allow a 2-week extension. So anyone who is currently in the campground can stay for the next 2 weeks until March 31st. Even if that brings you over your 180-day stay, a waiver will not be required during that 2-week period. Additionally, we are going to halt any inbounds. And again, this is to follow the guidelines of trying to limit large gatherings. And so we do apologize if you had a reservation and you are coming in the next 2 weeks. We are going to ask you to remain in place where you are. And then hopefully in the future, you'll be able to come and camp with us.
Thank you, Kim. I appreciate it. If we could have Major Dupuis, if you could come on up. There were a couple questions about the stop movement. And if you could just give us a little update on what that really means if I'm PCSing here in the CONUS versus overseas. Should I allow my household goods to get packed up? What about my car? I saw that was a question out there. Can you just give us some quick advice of, you won't be able to answer every single scenario. Where should people turn to for answers?
Yes, sir. So good afternoon. I'm Major Chris Dupuis, Logistics Readiness Commander. So as stressful as moving already is, we understand this is more of a stressful time when you add COVID-19. U.S. Transportation Command is providing us updates on a daily basis on how your move will go. They are having to work with the local carriers through the Personal Property Office and GIPSO. Unfortunately, none of the services currently agree on what should occur. So that makes it very difficult, since at MacDill we have multiple services here and there are different regulations guiding each when it comes to moving. Specifically, the Army has a lot more stringent requirements than the Air Force at this point in time. If you're an Air Force member, so backing up, I recommend if you have any specific questions regarding your move, call our office at 828-2600, and a personal property office assistant will help you look at your move and determine what is the way forward. If you have a move scheduled currently, you will, if it has been booked through the TSP, then the move will continue as planned. However, you will be receiving a phone call from either my office or GIPSO to determine if you wanted to reschedule your move to reduce the burden. If your move has already been packed and in transit, it will go. Basically, the bottom line for the Air Force members from GIPSO is we can't move people, but we can still move cargo. So if it's something you determine that you desire, we can still look at having your household goods moved so it's there upon your arrival. For Tier 3 country locations, OCONUS, that is very variable right now, so I don't want to put anything out there on air. I recommend you just call our office at 828-2600 to get your specific information for your specific move.
Thanks, Chris. And as of this morning, I think we had about 118 airmen or so that were going to be affected by this stop movement for now. The other key thing I want to put out for all of our service members, if you have a question and you can't get an answer from TMO, please go to your chain of command, let them know, especially if you're facing a hardship, whether it's household goods or financial, whatever it may be. Turn to your chain of command, and then your chain of command will work tirelessly to try and make sure you and your family are taken care of. So with that, Lieutenant Hanner, I'm going to toss it over to you to see what questions we have out there.
So we have a question from Sandy Hoff. Is COVID-19 testing available on base? If yes, who is eligible and what are the criteria? And if it is available, where will it be?
Sure. I'm going to toss this question over to Colonel Vic Whedon. He's our Deputy Medical Group Commander. Vic?
Good afternoon. Regarding testing, it is available here on MacDill Air Force Base. We have test kits available in the medical group, and all eligible beneficiaries, if it is determined clinically that they require the testing, that can be accomplished and sent to laboratories as deemed appropriate based on the situation. Regarding the testing criteria, I'm going to ask our Public Health Emergency Officer, Major Dr. Neumoff, to comment real quickly on the criteria that would make a test necessary.
Afternoon, I'm Dr. Neumoff. So the criteria that we used to determine if someone's going to be what's called a person under investigation are are 6. And I'll just read them off to you so you can kind of wrap your head around if this applies to you or if you say, no, this is not me. A person has had a close contact with a laboratory-confirmed COVID-19 case and fever or symptoms of a lower respiratory illness, cough, shortness of breath. The person is part of a non-household outbreak of suspected COVID-19. So that basically means if your particular work center or wherever you're kind of existing, not outside the home, there's been a lot of people who there's concern for a COVID-19 outbreak that would apply to you. A person who's hospitalized with unexplained respiratory illness, or a person who, or a person who died. Again, that wouldn't apply to anybody, but if you were hospitalized, it would. If you have traveled from Oconus and you have symptoms of fever, shortness of breath, dry cough, that would apply to you. Person has had community contact with a laboratory-confirmed COVID-19 case, and again, fever, symptoms of a lower respiratory illness, and that includes cruises. And again, applying to fewer people, but still, if you're over 65, you have chronic medical conditions like diabetes or you're immunocompromised, and you have those same symptoms, and that would apply to you. So there's those 6, but we also realize that that doesn't always capture everyone, and we try to use good clinical judgment to say if you've traveled somewhere in the U.S., you've been to a place that's a big hot spot, you hung out with an entire family and every single person had COVID-19, we try to think logically and include you in that criteria if it makes sense.
Hey, Doc, so if I can ask a follow-up clarifying comment. So we said we've got test kits here at our MacDill Med Clinic. Does that mean if we do the swab and we can get the data immediately here, or what do we do with those test kits? What happens when we do that?
Yes, sir. So we do have the swabs, and we take a sample, and then we send that off for testing, and that would be at the Florida Department of Health. And at that point, if they say that you are positive, you are positive. The turnaround time for that, as I understand right now, is about 24 to 48 hours, and as we test more and more people, that's going to start to bottleneck, and that may extend, but I think that's where we are right about now.
And so, Doc, if I have one of those symptoms that you talked about, or those meet those 6 criteria, which if you have questions about that, folks, please, you can go to our MacDill COVID-19 website or go to the cdc.gov website for those specific criteria. But Doc, if I feel like I meet any of those criteria, should I just come walk into the clinic? What should I do?
No, sir. That's exactly what we don't want you to do, because there's a lot of people who are sick in the med group, and we don't. If you do have a medical scenario where you might have the coronavirus, we don't want you bringing that in and spreading it to a lot of other people. So the important thing to do is call ahead if you feel that you have symptoms. You can call the appointment line, and they can kind of help walk you through what your symptoms are, or you can call the public health on-call phone number, which is 813-244-1764. And there will be somebody that will be able to walk you through your scenario, confirm your symptoms, maybe help you think critically about it, and direct you to the appropriate course of action, which may involve coming to the med group, but we may meet you outside, put a mask on you, bring you in quickly so we can take you to a negative pressure room, or say, you don't sound so great, you might be a little bit unstable, let's have you go to the ER. We can kind of walk you through that thought process before you come into the med group and affect other people.
Thanks, Doc. Appreciate it. LT, back to you.
So for a follow-up question, we had a question come in. Since we're being advised to stay home instead of coming directly in, will Childcare cover over-the-phone appointments with certain doctors that charge for appointments?
Vic, to you.
Regarding charges for over-the-phone appointments, I will need to take that question back to our medical group experts, and we will certainly get an answer as soon as possible.
So we have another question that came in. This one's pertaining to deployments. It's coming from Anna Harry. She says, I'm scheduled to deploy. Am I deploying in 2 weeks?
Anna, so that's a great question, and I haven't checked my email now for about an hour, so I'm not sure what changes have happened. That's how rapidly these things are changing. As I walked in here, we were still considering deployments as mission essential. We were moving forward with those. But what I would say is just stay connected with your chain of command. Keep pressing forward as if you are going to deploy. And if that situation changes, then we'll adapt to it. We'll work together with you, with your chain of command, and we'll figure it out. But right now, the situation is so dynamic. I can say, yes, you're going to deploy, but don't hold me to that because we don't know if the situation is going to change.
So, sir, a question on the opposite end of deployment. So, redeploying. W.L. Decker says the 91st ARS is currently deployed with orders to come home mid-April. Has that changed, and are we coming home on time?
Again, it hasn't changed as far as I know. Just before walking in here, it hasn't changed. What I'll tell you right now for our 91st as well as our 6th maintainers and as well as our OSSers, we're thinking of you. We're really proud of you. And we're going to get you back when the time is right and when operational requirements allow us to. That said, please keep your chain of command firing back the questions. And as soon as we have any information, my promise is we're going to be completely transparent and we'll get that information to you. Other thing too, for your families that are back here, if they have questions, make sure that they're talking with the key spouses or talking with the chain of command. I'm hosting a teleconference later this week with our wing's key spouses just to give them an update, answer any questions or concerns that they might have. So we'll make sure we're reaching out to those key spouses and having them dial in. But my promise to you is to be transparent, and as soon as we have that information, we'll get it right to you, your leadership, and they'll distribute it.
So, sir, this one applies to ID cards. From Brandon McQueen, my wife's ID has expired. No IDs were available at that time. Do we currently have the ability to make ID cards?
Sure. I'm going to have Lieutenant Colonel Light come up and talk about what the various closures mean, particularly with MPF and ID cards. Kim?
Yes, sir. So 2 parts to that question. So our MPF, our military personnel flight, is moving to mid-manning, again, to practice the social distancing. I think that specific question was in regards to a dependent ID card. So we still do not have any of the Teslin card stock that we print those on, and that is an Air Force-wide shortage. So what you can do is you can absolutely walk in. We are still providing walk-in services for our mission essential, and in that case where someone's ID card has expired or will expire in the next 7 days, our walk-in services are from 7:30 to 11. We are open for walk-ins additionally after that. Mission essential, we're certainly there to help take care of our customers. But what we're going to have to do in that case specifically for a dependent ID card is to issue an 1172. It's the form, the DEERS form that your spouse will be able to use to get on base. We've coordinated that with security forces previously, and then also to continue to have Childcare service. We will have all this information posted for the FSS on our public Facebook page. In addition, it's always linked from the main MacDill page, but our page is MacDillFSS.com. One other thing I just wanted to know about the MPF is that during this stop movement time, folks are still allowed to continue to separate and retire as previously scheduled. So those final out appointments that are already scheduled will continue as normal. I will have folks there just ready to process you and get you through and out the door, just as we would always do.
Kim, while you're up there, can you talk about transition assistant program courses, TAP? Are we still leaning forward with those courses, or what's the plan there?
Yes, sir. So we do have a TAP workshop, which is normally a 50-person workshop scheduled for next week. And so what we're doing today, we're in the process of contacting all those folks. There's going to be a couple options for you. The first will be to reschedule at a later date if you have that ability and you still have a little bit of time before you retire or separate to get that in-person workshop. A second option would be to do the required training online. And so there is a website that you can go through and get all the same information just in an online format. That does meet the congressional mandate. And then a third option that we're still looking into, I don't have an answer on it right this moment, but potentially offering the class next week in an online format where our instructors will still come in and teach the course, but you will just be able to log in from your home. And so like I said, we are going to contact everybody who is registered for that TAP class next week, and we will let you know in the next day or so as far as what exactly the plan is going forward.
These are interesting times, and so we're trying to capitalize on every bit of technology we can and change the paradigm of how we deliver regular services. We know it's not going to be the same, but we still want to deliver the same quality services to our service members and their families.
Yes, sir.
Okay, LT, next question.
So a question regarding the extension for FAMCamp. Michael Salone asks, we understand there's a 2-week extension. What if I need more time?
So of course, again, a dynamic situation. So if the base continues in our mode of operations that we are now, we will reevaluate, and we will certainly let our customers know if we are going to extend that period of time. If we don't expand it to everybody, if we go back to our normal operations, but you, in your specific case, do need an extension, there is a process in which you can request that. So you'll just need to talk to the staff at the Outdoor Rec office, and they'll be able to explain that whole process to you to be able to get the waiver in case of a hardship for you personally.
And for all of our viewers out there, we're taking an incremental approach to this. So for a lot of these MWR services, we're starting out with that initial couple-week closure, and then we're going to reassess as we get closer to that expiration date. The goal is trying to restore services back to normal as soon as we can, but doing so responsibly, looking at the global situation and the local situation to make sure we're not taking undue risks. LT?
So we have a question from Al Gonzalez and a few other folks. It's regarding the BX Commissary, Class 6, and the gas station. Other bases have limited services to active duty only or closed those facilities. Will MacDill close or limit those facilities to active duty only?
We're in conversations with DECA every single day about their status, their stock, if they need help. So we are not there yet. We're not instituting anything beyond what we already have as far as limits on specific paper products, on products such as sanitizing wipes and antibacterial wipes, things like that. But we're going to keep watching that. And again, to my earlier statement of we need folks to buy with integrity and with responsibility. Think not just about themselves, but to think about all of our service members, families, retirees. And as long as folks are acting responsibly, I don't think we need to change it right now. But like I said, this is a very dynamic situation, and we talk every single day with the manager at DECA. And if we have to make those changes, then we absolutely will.
So a question regarding contractors and closures that apply to contractors. Katrin Henderson asks, how do all the closures on base apply to contractors, and who should we contact?
I think my initial answer is we've got to contact who you work with. But Colonel Phillips, our Mission Support Group Commander, can you take this one?
Yeah, for contractors, I'd recommend that you talk to your contracting officer representative. Depending on what the contract is, as the wing, we support all contracts that support the wing and also for the COCOMs and many of our tenants on base. So depending on the posture of that particular owner of that contract, the COR, contracting officer representative, should be able to give you further guidance.
So going back to COVID-19 testing, Lori Keene asks, can a dependent get tested for COVID-19 on base?
Yes, the dependent can get tested on base as an eligible beneficiary at our clinic at MacDill. And as with all of our beneficiaries, will be evaluated clinically and determine if that testing is appropriate at that time. So a dependent is eligible.
So a question from Alfred Marino asks, what are the current chances the base goes into quarantine/lockdown? And if so, when will this take effect?
So you've probably heard me mention earlier the health protection condition alpha. There's escalating different health protection conditions based on the condition, not just on the base, but within the community writ large. To directly answer your question, we're not even close to a quarantine or shutting down the base. Besides having just our flying mission, one of a huge part of our mission is supporting the installation and supporting all of our mission partners that are here on the base. So we think it's important. We've got to keep our gates open. We have to make sure that the flow of not just our employees and service members, but of goods, of contractors, of everything that we do to sustain daily ops are coming in and out of the base. So we are not close to closing the base or under any kind of a quarantine at all. But again, this is a very dynamic situation, and we will continue to assess the situation hour by hour. And if we have to get to that point, we could always resort to that. But given where we are right now, we aren't close to that.
So a question, going back to the commissary, Donna Rosario asks, there's been a lot of bulk buying at the commissary, and I'm concerned with the lack of food at the commissary. What are you doing to remedy the lack of food at the commissary?
So I'll answer that initially, and then I'll have Colonel Phillips tie up my loose ends here on this one. Again, we've instituted buying limits on some very specific products. But we're constantly communicating with DECA to try and find out if there's further measures that we need to do, whether we transition to active duty only and dependents, we'll see. But we're not there yet, but we're going to keep assessing the situation, and if we have to do that, we certainly will. We just ask people to shop responsibly. Colonel Phillips, is there anything more you can add to that?
The big thing is we've been in contact with DECA, and they are tracking incoming trucks to replace. There is no impact to the logistic chain to bring goods and services, whether they're food or paper products, to there. The only question is if we continue to buy at an increased demand, we will have to wait in between shipments. But we are tracking multiple trucks that will come and resupply this week.
So this is referring back to essential personnel. Vanessa Camacho asks, when you decided to make it mission essential personnel, is that certain agencies within the wing, or does that relate to COCOMs as well?
That is strictly for the 6th Air Refueling Wing, and for folks that are part of the 927th Air Refueling Wing, I would just ask you please make sure you talk to your chain of command within the 927th. But that mission essential only personnel, it allows supervisors within our wing to assess who do we need on shift given the current operational requirements. We are still flying out there. We're still making sure that we maintain our mission readiness, because it's not just the community that's watching us, it's our adversaries. So we've got to be able to respond at a moment's notice, and being able to recall what personnel we deem mission essential whenever we need them is absolutely critical. So Wilhelma asks, is the med group doing anything to keep non-COVID-19 patients safe? Are any precautions being taken to ensure that we prevent that?
Yes, absolutely. One of the most important procedures that we've implemented is our screening process and triage process to ensure that potential COVID-19 patients are screened properly before arriving at the med group. So going back to what Dr. Neumoff said in terms of calling public health, and the number he provided is essential so that the person could be screened over the phone first before coming to our clinic. If deemed necessary to come into our clinic, that person is met by a public health representative and escorted directly to the clinic where they need to go. So our intent is to separate and keep those patients that potentially have COVID-19 separated from our other patients and staff. We'll continue to monitor these procedures and adjust as necessary.
So the next question is from Courtney Guion. She asks, I have a PT test scheduled next week. Is that still happening with the closure of the gym?
All right, hello again. So with the fitness center, we will close the fitness center today at 8:30 p.m. today. Today was our last day of fitness testing through the 29th of March. So anyone who had a test during that time, we will reschedule you, or through your UFPM, you will get rescheduled for a future test date. If you are affected by this with the upcoming Senior Airman SCOD, then you'll just need to talk to your chain of command, and we'll get that figured out. So nobody should be concerned about that. We are not impacting anybody's ability or any future potential for promotions or anything like that with your evaluation. But you will need to get rescheduled once we go back to our normal operations.
Thanks, Kim. And I think it speaks to the broader topic of we're trying to take care of this in manageable chunks. So, the old proverb of how do you eat an elephant, one bite at a time. This is kind of one of those situations where our primary goal right now is making sure we're protecting service members, their families, as well as our retiree populations and our government civilians. So we're taking a lot of those steps now, including closing the fitness center and transitioning to mission essential only. We realize there are going to be many ramifications and second and third order effects of doing these closures, of not having fitness tests. We just ask you to be patient. We're going to work through those. We're trying to think of everything, but I'll guarantee you we won't think of it all. So keep those questions coming. Either put them on Facebook, but my preference is send your questions to your chain of command. And that way we can get after the things that we're seeing are the most common trends and things that could potentially affect you, your career, and your family's health and safety.
So a question about TMO. Amanda Carl asks, my husband goes on terminal leave soon. Will he be able to move with TMO still?
And Major Dupuis is going to take that one.
So one of the things that the household good industry has determined is that if you're separating or retiring, then this will not affect you. You will be able to continue on with your household good move following your separation or retirement from any of the DoD services.
Thanks, Chris. And that's right in line with what Lieutenant Colonel Light had said about you can still do your final out processing as you are separating or retiring.
So Jesse Pena asks, what is the plan for construction at the BX? Is that going to stop? Is there going to be any delay to the construction at the BX?
Right now, I don't think so. I'm considering those construction projects as mission essential. We need to continue forward with all of the improvements and upgrades to our installation, but that is as of right now. And whether it's the BX or any other construction project on base, we're going to continually assess. And if we think it poses a risk either to those workers or to the service members that are here on base, then we'll make a change. But as of right now, we're leaning forward. Eddie, respond? Okay.
So, sir, a question about volunteers. Andrea Thompson says, I'd like to volunteer if help is needed anywhere. Is there going to be availability for volunteers? What do you suggest for volunteering on base to help?
Colonel Phillips?
Yeah, I mean, currently we need folks to be separate, to stay indoors and do that. We don't need any volunteers right now at this point. That may change in the future. But if you have a hobby and you want to put it online and teach someone, how to paint, we saw someone reading child's stories online. So if you want to do those types of things online and share a little bit of yourself with the community, that's a great way to help out right now.
Yeah, and that's a great point, Eddie, of making sure that even though we can't physically connect with each other, make sure we're still socially connecting. Talk to airmen. Find out if someone lives alone. You can still pick up a phone. You can still call them on FaceTime or MySpace or whatever different medium folks are using these days, because we still have to stay connected. LT.
So a question about the medical group. Ladybug Johnson asks, can we get a separate med group entrance for those suspected of infection for COVID-19?
That's certainly a consideration we'll take aboard. We are at this time utilizing the main entrance and screening everyone that comes in and then separating them at that point. We are looking at other options in terms of separation external to the facility, but we'll continue to look at all potential options.
Hey, Colonel Whedon, while we've got you on the microphone, I saw a question earlier, if I can ask it. Can you talk to what the impacts are to the Sable Park Clinic?
Yes, sir. At this time, there is no plan to modify Sable Park operations, except for one exclusion that was published through a PSA across the installation, where we are now processing new prescriptions here at MacDill at the actual main pharmacy, and all refills are now being processed through the refill drive-through, trying to divert as much as possible these types of operations through our drive-through three-lane operation.
So we have a question about being able to pick up meds. We know that there's the pharmacy is available via drive-through. Is there any plan to change that, or will there be any type of changes to being able to pick up pharmacy medication?
As it stands right now, the drive-through operation is fully operational with no plans to adjust at this time.
So CJ Vogel asked regarding PCSing and TLF, are there any plans to open up TLF for families in the middle of PCSing? My report date has been pushed back to May 11th.
So CJ, what I would ask you to do is please let your chain of command know, and also you can reach out to the billeting office and give them that question. And we'll evaluate it. But I think the key point right now is, especially with all the turmoil that we have right now, is engage your chain of command about kind of the challenges that you're facing. I'm right there with you. I'm supposed to PCS towards the end of May, and I'm not quite sure exactly how that's going to pan out. I know we've got a stop movement for 60 days, but it kind of keeps coming back to, I think 60 days it's an initial guess. The president said, I believe last night, that this could extend into the summer. So the main thing for all of us is to stay safe and to remain flexible and make sure we keep that communication going and asking those questions. Because the truth as we see it today, it may not be what the circumstances are tomorrow or next week or for you and I when we PCS in May.
So the next question is regarding visitors on base. Amber Goodman asks, can visitors still come on base with a pass? More specifically, next week, since there is a mission essential personnel notice out right now.
Yeah, sir, I can take that one. So right now there are no changes to who can or can't come on base, so visitors are still welcome under the same rules. What we are going to do is try to limit the amount of people that it's in the visitor center at once to 10. So if you see a big crowd in there, then we ask that you wait in your car until we thin out the visitor center. But right now, no changes to who can come on.
So a question pertaining to food trucks and food services. Heather Davis asks, are food trucks still allowed on base? Will there be any restrictions to that?
Yeah. So currently, to those AFEs and DECA features, whether it's the gas station or a food truck, no changes to any of those services at this time. But be aware, depending on the situation, it is fluid and we could change that. But right now, there are no discussions.
So a question about veterinary services. Will veterinary services still be available at MacDill?
At this time, veterinary services are still fully available.
So with recent closures, Michelle Knight asks, the month of military child is here. Are there any changes to the schedules for those types of events, or are any of the events canceled?
So I won't speak specifically to this, and I can turn it to Kim, but what I will say is please keep going to either the FSS website or go to our MacDill website because we're going to constantly update what different services as well as what different functions are not going to go forward. But Kim, can you talk briefly to that?
Yes, sir. So what we've done is we've looked at our calendar over the next 2 weeks during this initial non-essential personnel time on the base. And so most all of those events have been canceled, will be either rescheduled or postponed. As far as the month of the military child events, those fall just outside of that. Our first event is that first week in April, so that will still to be determined. We certainly would love to still be able to have that parade, but we will just have to see how this situation evolves. One note I did want to make as far as events for our current Airman Leadership School class, we will continue that course through this Friday. They will graduate a couple days early, and we will feature their graduation via Facebook Live event like this so that all of the family and friends can still partake in that event.
So we have a question about quarantine. Priyaja Cooper asks, if my husband is quarantined, what should my kids and I do?
Okay, so I'll turn that over. I don't know, Vic or Doc, if you want to take that question. When especially someone comes back, if they meet some of those criteria, what does the family do?
Yes, sir. So if a patient meets those criteria, then they would likely be tested and they would be asked to self-isolate. We have a high probability that the family would be in close contact with that individual or would have been in close contact with that individual, so we would ask that family to remain self-isolated as well. In the case that a service member is coming back from Oconus, they're asked to have restriction of movement to their house, essentially, for 14 days. In that scenario, the family would not necessarily need to stay in the house, and they could move freely. But in that scenario, we ask that the active duty member sort of limit contact as much as possible with the family in a room, minimize touching with family members and pets, just until we can kind of rule out that they have a virus that's developing.
Doc, that's I appreciate that answer. That's easier said than done as a loved one is coming back from a deployment to their family. So I know we had an earlier question from someone from the 91st, and as they are coming back from their deployment, how then are we going to handle that? We owe you some better answers of what those specific procedures are going to be like. We've already blocked off some rooms within our billeting facility for folks that come back if they want to isolate away from their families. So we're looking at that scenario and working with our mission partners on how we handle that. But for all of our returning deployers, we're on it. We're taking a look and trying to figure out exactly the completely unambiguous instructions of what we can give you and how we walk you through that. LT.
So the follow-up to that, Ms. Cooper also asks, if I work in the med group, is it safe for me to go back and forth to work if my husband is quarantined?
Yeah, Vic. Quarantined or self-isolated?
Yeah,
that's an important differentiation.
The self-isolation requirement for the member that's not exhibiting symptoms, which would mean that the family member, the employee coming to work, would be fine doing so. If there's any symptoms, either of the self-isolated member or the family member, the employee, then we would need to be notified of that, and then we would take a look at that situation further.
So going back to the Child Development Center, Sarah Brown asks, if we have to find alternative childcare, are we going to be refunded for that instead of being credited to the CDC?
I don't think so. We can, I tell you what, we'll get you a definitive answer on that. We'll publish that online. I think the answer is no, but I don't want to guess on that. And we've got our comptroller in here who's feverishly writing down that question. And so we'll publish that specific line.
So John Alvarez asks, are medical group contractors considered mission essential?
For medical group contractors, our contracting liaison and contracting manager has coordinated extensively with the contracting squadron and deemed that at this time, because we're fully operational status to maintain our maximum medical capability, that they are to be on duty, and if that does change, then we will coordinate with the contracting officer and the contracting squadron immediately and make everyone aware of their status.
So Sherry Reynald asks, are there any plans to set up video chats with medical group providers instead of having to come in or have a phone conversation with our PCM?
We will definitely take that away as an item to consider. At this time, we are looking at every avenue for doing virtual patient care encounters. At this point, we do not have the capability to do VTC or video patient appointments. We certainly do by telecon and by phone and electronic virtual appointments, which we are focused on and trying to do as much as possible. But we continue to look at all options, and we will evaluate it when we will evaluate every option possible.
So a question pertaining to deployment. Bethany Newsom asks, if me and my kids get exposed to COVID-19, can I have my husband return from deployment on hardship?
That is a really hard question. I don't know. I honestly, I don't know about that. I think just for me sitting here as a wing commander, I don't have the authority to answer that. That question, that determination would be decided at a much, much higher level. So even right now, as we think about, even though we have a stop movement for all PCSs out there, waivers can still be requested, but it is going all the way up to the first general officer in the chain of command. So any kind of a request or a situation like that meets a hardship, I think what I would say is engage your chain of command or your spouse's chain of command immediately, and we would absolutely see what we could do. But at the wing commander level, I just don't have that kind of authority to say yes or no. But there is a waiver process that we could try to make that request.
So this question refers back to Child Development Center. Amy Maria asks, what about CDC and childcare safety? Why is group care still an option?
Kim, do you want to take that?
So at this time, we are continuing with our childcare operations as normal, as I mentioned before. However, it's important to note that within the child development centers, there's separate rooms for each group of children, and those children stay within that room. There's not much intermingling between that. Certainly, we are watching all of the Center for Disease Control information and any guidance that may come from our higher headquarters. But at this time, it has been deemed safe to continue our child care operations. There are a lot of practices in place, even just normally, when it comes to dealing with kids, to try to mitigate any spread of any type of cold or flu or any of those type of symptoms.
Thanks, Kim.
So this question refers back to leave. Brian asks, are there any restrictions on civilian leave during this time?
The latest DoD guidance, I believe, does not restrict civilian leave. It does, however, recommend safe practices and to avoid all unnecessary, non-mission critical type of travel. So for our members, it's very clear. Our uniformed members, it's very clear. But for our civilian airmen, current DoD guidance is not restrictive of government civilians. But like we said, think about what is the responsible thing to do when it comes to our service members, our families, and basically our mission readiness. Is that leave truly necessary? I know it's inconvenient. I know we're asking for a lot of sacrifice and for a lot of changes about how we do our normal day-to-day ops. However, times are different. And so I would just ask yourself, your family, is this truly necessary? Should I really take this trip?
So a question posed, can someone explain what household outbreak means in regards to testing criteria at this time? Both my husband and I are symptomatic. Can we get tested?
Doc, could you come on up and answer that?
I think the scenario where it's considered an outbreak is if you've got some confirmed cases. So lots of people could get sick at the same time. It doesn't mean that they have COVID-19. Everybody might have a cold. There might be the flu going around. But if there is a group of people, again, say at a workplace or your workout class, and a lot of people have met criteria for testing, and maybe some got tested and are awaiting results, then that might be considered a potential outbreak area, and then you would be more highly considered for testing. But everyone just kind of being sick without any other criteria or increased index of suspicion, I wouldn't consider that an outbreak.
So, Doc, for this one specific typer or Facebooker, I'm not sure what we call this, what should she do?
So I would maybe think through some of the PUI criteria that I mentioned. I know I'd read them off before, but if you still have questions, call the public health on-call phone, call the appointment line, and they will walk you through that triage scenario and help you think through it.
Just an additional comment, I would highly encourage the person that asked the question to follow up with a nurse advice line call the number that's been on the PSAs that have been distributed, call the public health number, explain your symptoms, and they'll go through those with you. And then if you need further medical attention, then you'll be guided to do so.
And we'll make sure we have those phone numbers are listed on our MacDill Air Force Base COVID-19 website. So in case you have any questions or who to call, it should be listed on there.
So John Alvarez asks, why can't med group folks that can telework be allowed to telework?
Okay, yeah, please, Vic.
At this time, we are fully operational as a medical facility, maintaining our maximum capability. For members that are eligible to telework, we are looking at all those individuals across our facility and case by case to determine if they're needed to accomplish our mission, and we'll continue to do so. But at this time, we've assessed that we need all individuals, all employees available to support our mission, and of course, which is a medical type of pandemic outbreak.
So Melissa asks, can you please talk retirements? Can members out-process at this time due to all the closures that are happening around base?
Sure. Yes. The answer is yes. Now, if the member is trying to get access to a specific organization on the base that has reduced their manning, that's one of those occasions where every single office, even if they have reduced their manning, they should have a phone number available for any kind of emergency situation. But yes, you should be able to out-process. And again, if you're running into blockades or having issues, work with your chain of command, and chain of command will get engaged.
So Nina asks, is the tax center remaining open and keeping appointments? I have an appointment, should I cancel?
Do we know that? I'm not certain. We'll get you an answer. I don't know that. We'll get that out there.
So Rosa asks, I'm currently on leave. Can I travel to Orlando to visit my family?
If you are there's so many different layers to that question. The best response is call your chain of command and ask them what the current policy is. Depending on what organization you are in, may change that answer. The DOD has said for all uniformed members, if you are currently on leave, you should return back to your station, but that is going to be up to the commander. For members of the 6th Air Refueling Wing, folks that are currently on leave have until Friday at midnight to get back here, unless they get permission from their chain of command to extend longer. For folks in different chains of command, that might be an entirely different answer. What I will say is I understand folks want to recharge and take leave and connect with friends and family. This is a time for disciplined isolation and going and seeing your family. You never know what germs might be introduced to you and your family, as well as to your extended family as you go in there. So I would just ask and recommend follow the CDC's guidance, follow the guidance that our nation's leaders have given us, and isolate to the max extent possible.
So Karen Lloyd asks another question for the medical group. Are immunizations at Sable Park still available?
So we have time for 2 more questions.
My understanding at this time is that they are available, but I will confirm and we'll get a response to you as soon as possible.
So Cody Pratt asks, what changes to our flying schedule can we expect?
So Cody, that's a good question, and we're evaluating that every single day of what manning we have, whether it's maintainers or our fuel dogs or anyone else who helps make this mission happen. But at the core of this, of what we can't forget, is while we're trying to defeat the enemy that is COVID-19, we have to make sure we maintain mission ready. So we have to be disciplined. We've got to lean forward, but we have to be mission ready because we never know what adversary is going to be out there and try to take advantage of this opportunity. So talk with your chain of command. We're going to do our best to make sure that we're mission ready to meet whatever nation's needs there are. But talk with your chain of command, and they'll be able to give you an update.
So, sir, we're reaching the end of our time here. We have time for one more question, and then after that question, if you have anything you'd like to add or final comments.
Sure.
So Caitlin asks, are we still able to make changes in DEERS?
Kim?
Yes, as previously mentioned, the military personnel flight will still remain open for our mission essential operations. So if you need to make a change, like you just recently got married, congratulations, or you had a new baby and you need to add that child to DEERS, you absolutely can still walk in and do that from 7:30 to 11, or even until 15:30 if you need to, and that's when you can get in. We will have folks there able to service you. I will ask if it's something that can maybe wait a couple weeks, or that's not essential for you to get updated right now, then just take that time to pause and wait and come back when we're up in our full operations. But certainly we do not want to impact anybody's Tricare or anything like that. So if you do need to come and enroll someone in DEERS, you absolutely can do that.
Thanks, Kim. So, folks, I'm going to just ask, please keep those questions coming. We'll do our best to answer them as quickly as we can. I do want to thank our panel of experts for your insight, your expertise. Fantastic job. And I also want to thank our public affairs professionals. There's a whole army of folks behind the scenes here that you don't see that were here up late night trying to make sure that this worked. So thanks to those PA professionals for today, as well as for all of your communication that you're heading out to our service members and community. I want to close with the same statistic that I opened with. We have had 0 confirmed COVID-19 cases here on MacDill Air Force Base for our service members, our civilians, as well as our family members. We got to keep it that way. So follow the CDC guidance, including social distancing. Our community, our friends or neighbors, they're going to be watching us and to see how we treat this emergency. Are we setting an example? Are we taking this as seriously as our nation's leaders have asked us to do? Our adversaries, they're also watching us. They're not going to wait idly by for us to defeat COVID-19. So we need to be ready to answer the call even in the middle of this crisis. We do this by staying healthy and staying mission ready. Your leaders and your families, your community, they expect us to act with integrity and professionalism, to follow the guidance that's out there while taking care of our wingmen and neighbors. Social distancing doesn't mean you have to stop talking to your friends and neighbors. I'm going to close our Chief of Staff of the Air Force. I think he said this perfectly. He said, commanding and leading when things are going well is a pleasure, but rarely remembered. Leadership during a crisis is an opportunity to rise to the occasion and lead through the storm. This is a time that will be remembered by all. So to all of you out there, be safe, make us proud, and keep leading. Thank you.